today. Made it to 10.
You passed.
No coffee, still made it to 10.
I'll get you coffee.
Okay, action.
Please tell us your name and start this by saying my name is.
Yeah, my name is Jeff Williams.
What is your relationship with Tri-State Community Health Center? And start this by saying my relationship with Tri-State Community Health Center is.
My relationship with Tri-State Health Center is long going. I've been working with them since I was a mayor of the town. They came and decided they wanted to put a clinic in, which we needed very badly. As I left being mayor of the town, I was president of the hospital board and worked with them and helped them get this facility here up and running. And then I retired off the hospital board, and they asked me to become their chairman of the board for their nonprofit for Tri-State.
What are the unique challenges you face as a board member in getting patients access to quality health care in this region? And begin this by saying some challenges we have in this region for healthcare.
Some challenges we have in this region and have had for years with healthcare as a doctor, getting doctors here to see patients. As you know, we're right on the border of Arizona, Nevada, and California. And California's repayment to their Medi-Cal and everything make it real hard to get a doctor to want to come to our area and work on our Medi-Cal patients. So that's probably been the biggest challenge we've had.
Okay. Can you talk about delivering high quality care to the patients in this population? What are some of the healthcare needs? Like, is it chronic disease? Is it diabetes? Is it mental health? Is it substance use? So start this off by saying some of the health needs in our area are.
Well, some of the health needs in our area are, as in any small community, it's the same things: chronic care, pain management, dental was big here, and with Maria's help, our COO, now we've got a good dental program going on with our facilities, and that's big. Because I talked to the doctors prior to getting that in, and they were all telling me that's where their infections are coming from. That's what they're seeing mostly is a dental. So that was one of the first things we worked on, was getting dental. We already have podiatry here, which is needed with the diabetics and everything. So we're still moving forward, still looking for doctors, more specialties. We just got our mental health up and running. And that's for the patients and the staff, because it's been a long go making this facility where it is now, and we're not done.
How does the board collaborate and collectively work together to ensure successful care here at Tri-State? So who do you work with in the community? So start this off with, as a board, we work with.
Okay, as a board, in the community, we work with the low to moderate income housing. We work with the county, St. Vincent de Paul, anywhere there's people that need set free, kind of a homeless type settlement, not even a settlement, it's a church that's helping the homeless in the city. We've been trying to work with all of them. We're gathering up all the insurances that everybody that Tri-State area takes, not just the city.
How important is federal and state funding to fund the Medicaid population or to fund this health center, since they get federal funding to do what they do? How important is that? So for this one, respond with, federal and state funding is important.
Well, for funding, federal and state funding is very important to the Tri-State group as a whole, not just the Needles Clinic. We bring needed health care to people that just don't have it, won't get it. They just refuse to go. And so we've been able to get our name out there, pull transients out of their hidey holes, and get them in here, start getting them some health care they've been needing.
How do you feel the community perceives Tri-State Community Health Care Center?
For the first 2 years, I would say they were shaky about us.
Start that again, because you're talking to me through the camera.
Yep.
That the community was shaky initially.
As far as healthcare with the Tri-State, the community was hesitant or shaky about the healthcare that would be provided here, because we've had a lot of doctors in the past that have come in, opened shop for a night and left. You come in, you get a doctor in here for a week, they talk a good game, they see what kind of reimbursements they're going to get, Medi-Cal wise, Medicare wise, what the population is, and then they're out the door. So with our 5+ years here now, we've gotten the confidence of the community that we're going to be here. We have good doctors with Dr. Serena and Dr. Paget and some of these doctors that are working with us now, not including our specialists who none of the doctors I've spoken with before ever brought any specialties in or anything. They just wanted to do general practitioner and get money and move on. So much better.
What do you think is the biggest strength of the health center, or the biggest value? And of course, you need to start this one off with the biggest strength that the health center provides, or the biggest value that the Tri-State Community Health Center provides. Is it the fact that they're here, they're operational? Is it that they provide all the some specialty services, that they're growing with the community? They assess a need,
Yeah.
and they grow with the community. So maybe this should be the value of the health center, is it evaluates needs and increases services to meet the needs.
Okay, the value of this health center in the city of Needles specifically is we have nowhere else for healthcare. There's nowhere else to go for general practitioner. There's nowhere else providing the specialties that we do provide. We're constantly talking to our patients and our community and seeing what we need next to bring in. We have a pretty good working relationship with the hospital, so if there's any issues there. But I would have to say the biggest asset is just being here and having somewhere people can come. You know, it's not an urgent care, but we do take walk-ins. If they're hurting or whatever, they can come in. And we are looking at expanding, you know, and maybe going to a health care type or an urgent care type setup.
What is your job in the community?
Personally, my job, well, currently I'm vice mayor of the city of Needles, and I'm a private investigator, and I'm a retired deputy sheriff in San Bernardino County, so that keeps me busy.
It keeps you busy. Is there anything else you want us to know about the health center, or about the needs in this region? Because this video is going to be on the value of health centers and really focusing on rural and urban as we get more to Riverside and San Bernardino area. Is there something else you've covered a lot, but is there anything you haven't said that you want us to know from your heart or from your perspective?
Well, just keep watching Needles and keep watching Tri-State. We're going places.
I like that.
I'm good with that.
Oh, yeah.
Yeah, that was good. I'm good. Are you good with that take?
That was very
That
good.
was perfect.
Okay, we need to get some room though.
Oh, no, you gotta stay for 60 seconds. They gotta check the room.
Okay.
Careful. I'm concerned about that background. Can that be moved out? The
background?
noise that we were hearing with patients and stuff?
A little bit.
Okay.
And maybe when we cut it, we'll just take the essentials.
Okay.
She said
'cause-
we're gonna do the,
What is?
The beauty is I have
shoot
that
that-
mic like really up
and
here.
we'll do the sound
Okay.
at the same time.
All right.
Okay, we're gonna do the room tone quiet.
Room tone, will.